Welcome to The Explainer. Today, we're tackling one of the most complex medical mysteries of our time, anorexia nervosa. For decades, the medical community has literally hit a wall trying to find lasting, effective treatments for this illness. But right now, a groundbreaking clinical study protocol out of Imperial College London is proposing a totally surprising, completely new avenue for treatment. And it involves a compound you definitely wouldn't expect to see in a hospital setting, psilocybin. So let's dive into exactly why researchers are turning to this compound, how they're testing it, and what it could mean for the whole future of mental health care. Okay, let's jump right into this. Before the researchers even finalized their clinical trial, they did something amazing. They actually sat down with focus groups of patients who have lived with anorexia, and one patient shared this incredibly powerful thought. In the core, you are always yourself, but during an eating disorder, you lose yourself. Starting here is absolutely crucial because it immediately grounds us in the deeply human, emotional reality of living with this illness. It isn't just some clinical diagnosis on a chart, right? It's a profound loss of self. Section 1. The reality of anorexia, the deadliest psychiatric condition. To understand why we so desperately need a paradigm shift, we've got to face a pretty stark reality. Anorexia is widely recognized as the absolute deadliest of all psychiatric conditions. Yet, crazy enough, research for it is severely underfunded compared to other things like depression. To put this into perspective, the mortality rate for individuals with anorexia is a staggering 11.6 times higher than the general population. No way around it, that's a huge number. Up to 20 to 30% of people who develop it will struggle with it as a lifelong condition. And tragically, a significant chunk of these premature deaths are from suicide. This is an urgent, massive crisis that demands some serious, outside-the-box thinking. And this brings us to exactly why standard treatments often fall short. Historically, the old focus has been heavily, almost entirely, on weight restoration. Now, obviously, physical nourishment is literally a life-saving necessity, but authoritarian refeeding regimes often completely overlook the underlying psychological distress. It ends up making patients feel completely powerless, alienated from their own bodies, and just misunderstood. Because of this, treatment dropout rates are off the charts, ranging anywhere from 20 up to 70%. So the old focus just isn't cutting it anymore. That's exactly what prompted researchers to seek a brand new paradigm, one focused on identity and mental flexibility. Moving on to Section 2, listening to the patients, redefining recovery. Like I mentioned earlier, before starting the trial, the researchers at Imperial College did something so important. They listened. They asked these focus groups of women with lived experience what barriers they actually faced, and most importantly, what recovery really means to them. And through these conversations, a massive misconception was totally shattered. Anorexia isn't just about physical appearance or vanity. For many patients, the illness actually serves a profound psychological function. They reported that it provides them with a perceived sense of security. It gives them a way to control their emotions when the outside world feels totally chaotic, acting like a silent communication tool for their internal pain. Basically, it becomes deeply, deeply tangled up in their identity and their whole value system. Which leads us to this really profound insight from the patients themselves. Recovery means finding yourself again. True recovery is this terrifying but absolutely necessary process of rebuilding your identity without the illness that has kept your head above water for so long. Patients often feel intensely trapped between logic and emotion. Like they know they need to recover to survive, but they are just terrified of who they'll be without the disorder. It's like taking off your armor in the middle of a battlefield. Section 3. Why use psilocybin? A tool for psychological transformation. So what does this all mean? How do you actually bridge that massive gap between a patient's logical desire to get better and their intense emotional fear of recovery? Well, this is where psilocybin enters the picture. Now, what's really interesting about this is that we are absolutely not talking about recreational drug use here. Psilocybin-assisted therapy is a highly controlled clinical tool. We're talking about the careful medical administration of the active compound found in magic mushrooms, used specifically to promote rapid psychological transformation and break the rigid thinking patterns that define anorexia. To put it simply, individuals with anorexia often suffer from severe cognitive rigidity and emotional avoidance. Their thoughts get stuck on this highly repetitive, anxious loop. It's like a broken record playing the same scary song over and over. Psilocybin aims to physically disrupt that loop. It creates a temporary window of hyperplasticity in the brain. Basically, it's a fascinating state of increased mental flexibility where patients can experience deep emotional breakthroughs, face the things they've been running from, and actually learn new ways of thinking about themselves.
Let's look at Section 4, How the Trial Works, the Clinical Protocol at Imperial College. Let's see how this builds. Because to test this safely, the team designed a highly controlled 6-week pilot study for 20 female participants aged 21 to 65. Now, these are patients who have had anorexia for more than 3 years and just haven't found success with standard treatments. Because everyday psychiatric meds can interfere with the therapy, participants are safely tapered off certain medications first. Then, week 1 is all about psychological preparation with a therapist. Weeks 2 through 5, that's when they have their 3 actual dosing sessions. Week 6 is dedicated to final integration, really processing what they experienced. But the wraparound support doesn't stop there. The researchers will follow up with these patients for an entire year afterward to see if these changes actually stick in the real world.
Now, you might be wondering what happens on the actual dosing days. The environment is incredibly controlled and safe. Step 1. There is always medical supervision on site. Step 2. The patient lies in a comfortable therapeutic room, and this might surprise you, but it looks way more like a cozy living room than a sterile hospital ward. Step 3. They use eye masks and listen to a specially curated music playlist through headphones. They're gently guided to look inward. And get this, a pair of trained therapists is right there, holding space for them the entire time, for the full 6 to 8 hours.
Another absolutely vital piece of this protocol is looping in the patient's support network. The therapists actively communicate with the participant's chosen family member or close friend. See, the researchers know that returning to normal daily life after such a profound psychological experience is tough. Having an educated, supportive network waiting for you at home is absolutely crucial to turning those clinical aha moments into long-term, real-world healing.
Moving to Section 5, Measuring True Recovery Beyond the Scales. So how will the scientists actually know if this is working? Well, to respect the patient feedback we talked about earlier, they aren't just staring at a scale or forcing a focus on weight. Instead, they're using a twofold measurement approach. On the psychological side, they're using extensive interviews and questionnaires to track eating disorder symptoms, their readiness to recover, and their motivation. And on the neurological side, this is super cool. They are taking actual pictures of the brain using fMRI scans and monitoring electrical activity using EEG caps. They want to literally see if the brain's physical networks are changing and becoming more flexible right alongside the patient's mindset. So ultimately, success in this trial is being measured by true, holistic psychological healing. Are the patients showing an internal motivation to actually engage in recovery? Do they show cognitive flexibility instead of that rigid, stuck thinking? Are they practicing self-compassion? And most importantly, are they reconnecting to an identity completely outside of their eating disorder? Section 6. Hope for the future. The first step forward. So the crucial point we really need to remember here is that this is a pilot study. Actually, let's be clear, it is not a definitive magic cure. Psilocybin is a powerful tool for sure, but this study is really just a foundational first step designed to see if this therapy is feasible, safe, and acceptable for people suffering from anorexia. But the data they collect here, it will be absolutely essential. It's going to shape the future of much larger scale randomized controlled trials. By meticulously tracking these brain scans, psychological surveys, and patient feedback, this small pilot study is laying the literal scientific groundwork necessary to potentially revolutionize how we treat the deadliest psychiatric condition in the world. Which leaves us with this final thought. When we look at illnesses that are just so devastating and completely resistant to traditional methods, we have to be willing to think differently. By combining rigorous clinical neuroscience with deep, empathetic listening to patients, these researchers are paving a totally new way forward. It really makes you wonder, how can we better support compassionate, patient-informed scientific research across all of mental health? Because if we want better answers, we need to start asking braver questions. Thank you so much for joining me for this explainer, and I really hope this sparked your curiosity to learn more about the future of mental health treatments.